Hello, welcome back to Political Science 400-500C, Public Policy for Health Security and Resilience. My name is Nathan Myers, and this is continuing our discussion on risk communication and communication strategies. And this presentation is going to focus on an example of an actual emergency risk communication strategy. This one was published by the United States Agency for International Development, or USAID, which has been in the news a lot lately. The agency has pretty much been defunded and kind of folded into the US State Department. But prior to that, the agency did a lot of work internationally on managing avian influenza outbreaks in foreign countries. And they created an emergency risk communication strategy document to guide those kinds of responses, both internationally as well as here in the United States, if necessary. So I won't go through it in great detail, but I did want to hit some of the high points, and I wanted to provide an example of an actual risk communication strategy document that you could refer to and kind of think about with the community that you're working with in your discussions, the city that you're kind of focused on. How would this relate? How would this information relate to a risk communication strategy for that community? So it provides a table of roles and responsibilities for an avian influenza communication task force. So of course, the person at the top will be the overall communication leader that will coordinate overall operations, determine how communication fits in the National Plan on AI, which stands for avian influenza and not artificial intelligence, is also a member of the larger AI or avian influenza response team. So you want somebody obviously who's coordinating the overall communication strategy, the messages that are going out, looking at, if you're going in, to another country, you need to look at how your plan fits with their existing national plan. So, if we're looking at this from a domestic US perspective, we need to think about how does our local communication plan relate to our state communication plan, and how does the state communication plan relate to the national communication plan? So then they have the primary spokesperson, the leader, recognized authority in animal or human health, resonates with the populations and has credibility and support of authorities. So it's saying here that the person who's primarily going to go out and go in front of cameras and talk to the media and do interviews should be somebody with a good background in animal or human health, somebody who is relatable, somebody who has credibility, and also somebody who the government supports as well. And it can be tricky to find somebody in this day and age, with everything being so polarized. It can be tricky to find somebody who kind of checks all those boxes. Because if you look at somebody like Dr. Anthony Fauci, prior to COVID-19, he was a very non-controversial figure. He's somebody who had served presidents, Republican and Democratic presidents, with great distinction, was seen as a very smart, able, responsible, respectable individual. But now, because of the polarization that kind of occurred during the COVID-19 pandemic, some people regard Dr. Fauci as, some people regard him as a war criminal, at worst, and dishonest, some people less extremely think of him as dishonest. And then there are people who still continue to think of him as a legitimate public health authority. So, you know, ideally you want to find that individual that everybody is going to be able to listen to and rally around. But politics can make that a very challenging proposition. Communication officer manages information and media relations, serves as point person for the media and coordinates spokesperson schedules and access to the media and other stakeholders. Writer strategist gives final release of all print and broadcast materials issued by the task force, obtains final sign off on schedules, press materials, and information distribution. So you want the person who is going in front of the camera and delivering the message, but then you want somebody behind the camera who's, making sure that the message is coherent and that everything's being fact checked and that the spokesperson isn't being overworked and being sent everywhere all at once. You want an animal health officer that can speak specifically to the animal issues. You want the public health medical advisor, somebody who's a specific expert on avian influenza. You want a legal counsel who can interpret constitutional law and advise on legal questions. So you want all of those positions ideally to be filled because this is the type of expertise that you're going to need throughout the response. So you want to identify that expertise before the emergency occurs so that you know who to contact, who to mobilize, and how to organize this group. And you're not figuring out things on the fly as the crisis is developing. So it talks about how communication materials have already been developed for a variety of national and international organizations. So a lot of good information, according to this, related to avian influenza is already out there. You just need to kind of adapt it to your own specific situation. So they talk about messages or talking points addressing prevention and control, addressing frequently asked questions, posters, text for radio announcements, public service announcement, flyers, leaflets, brochures. So basically what they're trying to say here is that you don't have to reinvent the wheel every time. There's already been people in international organizations, the CDC has done this type of work. People have been working with avian influenza for a while. So kind of taking what's already been developed and kind of updating it and repurposing it. But you don't have to start from scratch. You don't have to sort of reinvent the wheel with every outbreak. And then it just kind of continues, websites, presentations, training curricula, extension programs for farmers and agricultural workers. And then it talks about identifying partners and alliances. So who are you going to want to work with or need to work with during the outbreak? Obviously, the Department of Agriculture is going to be key with avian influenza because dairy cattle and poultry, turkeys, chickens are significantly at risk for infection. The Ministry of Foreign Affairs, which in the United States would be the US State Department. But if you're coordinating with other countries, you want to be in touch with the department within their federal government that manages international relations. Donor organizations, whether they're US domestic organizations or international organizations, you want to be in communication with them. make them aware of how the situation is developing, how it's changing, if needs are changing, if it moves from a situation where it's primarily a virus that's affecting animals to one that's becoming increasingly a threat to people, then donor behavior is probably going to need to change along with it. Because you may be moving from kind of a focus on surveillance and containment to one of, trying to develop vaccines and put more personal protective equipment out there and things like that. International, non-governmental organizations, relief agencies, development agencies, of which the US Agency for International Development was an example of one of these types of organizations. And this is kind of looking at it from a more international perspective, because a lot of times when these outbreaks or in extreme cases pandemics occur, it has sort of downstream humanitarian effects. It affects people's access to food, water, other types of health services. At-risk people, can be severely affected. There can be upticks in domestic violence and child abuse and things like that. So even domestically, you have to think about these downstream kinds of effects and think about, in your community and in surrounding communities, making sure that all basic necessities are met, including, protection against harm and maintaining housing and things like that. So in terms of your focus, you can focus more on the domestic non-governmental organizations and what role they could play in addressing these concerns. But certainly internationally, this is a big problem. Private civil society, religious groups, again, these are the types of groups that can be essential for meeting unmet needs, particularly providing volunteers. If public health authorities need volunteers, there are a lot of people who volunteered to participate in like vaccination clinics or to put on vaccination clinics during COVID-19. A lot of churches did that. But holding food drives, holding drives to collect masks and personal protective equipment, those sorts of things can be very useful. It talks about the role of law enforcement, providing security for vaccination sites, or the military being used to transport materials, since they're very good at kind of logistics issues. Business and media, we've already talked a lot about the media previously, but businesses, we saw businesses pivoting from producing one type of product and then focusing on producing personal protective equipment or building ventilators. So maybe the need for their regular product was going to be significantly curtailed because of the pandemic, but they pivoted and started producing products that would be more useful to the response. And a similar thing could happen with avian influenza, where if there were more masks or gloves or things like that that are going to be required, pivoting to producing those kinds of things. So thinking about some questions that are likely to be asked by community members and that should be anticipated. So I won't go through all of these, but the basic obviously is, what is H5N1 or bird flu? Am I or my family at risk? Are there any human victims? How will you know if more outbreaks occur? So again, being proactive, putting together some example responses to these kinds of questions. And then being able to adapt to changes in information, and being able to adapt those proactive responses as necessary. So working with the media, again, I won't go into this in too much detail because I feel like we've covered this previously. But you want to choose the media that is going to reach your target audience, which we discussed. You know, people who read hard copy newspapers versus people who regularly use social media. And that's not to say that, you know, it's an either or. Some people, a lot of people, in fact, do both. But you want to make sure that you're going to be able to capture that audience that you're trying to reach. So some media constraints might be a lack of resources or expertise in infectious disease, stringent deadlines, overly rigid oversight from government agencies that might limit their ability to report on a story they would like. So obviously, you know, the government infringing on the media is always a concern in any situation, but especially if the government is putting constraints on what the media can say. If they, you know, if they have factual information about an outbreak, they need to be able to get that out. That shouldn't be censored just because the government's trying to maintain a degree of secrecy. Stringent deadlines, you know, people in the press are often working on a deadline, so sometimes that hinders them from being able to get the whole story. So sometimes stories can be incomplete and misleading, even if they're not intended to be misleading. And again, just lack of understanding about infectious disease, lack of understanding about avian influenza, and how it can and can't affect human beings at a given point. So addressing those sorts of issues in the strategy. So I think that's it as far as this discussion is concerned. Again, I just wanted to give you sort of a real example of a communication strategy to sort of see how some of the ideas that we've talked about in more abstract kinds of terms are actually operationalized by government agencies. So if you have any questions about this, please let me know. Otherwise, thanks very much for watching, and I'll see you next time.